So this our unit cost programme is funded by NIHR. So the views expressed are those of the authors and not necessarily those of NIHR or the Department of Health and Social Care. So the plan for this hour is we've got 4 presentations lasting around 35 minutes, which will be recorded, and then we'll have 15 minutes for questions. So please add your questions to the chat, and the team will add them to our whiteboard. If we don't answer your question during the session, we will add responses to our unit cost website in a Q&A section. Slide 4, please. So in terms of the presentation, we'll be covering the history of the unit cost programme, unit cost calculations, the current programme, and patient and public involvement in our programme. Slide 5, please, Alan. I think many of you will know that we sadly lost Jules Fulder last year. He was a significant team member from developing the funding proposal to publishing our first 2 unit costs of health and social care manuals in 2022 and 2023 within the current programme. It is a great loss that we lost. Jules passed last year. So slide 6, please. So in terms of the history of the unit cost programme, knowing the cost of something is key to making informed decisions about what to buy or use. We typically rely on labelled price of items to quickly tell us what it will cost for us to buy them. However, prices in health and social care services are rarely published. So this is the motivation for calculating annual costs of for health and social care services. PSSIU, we've produced the unit cost estimates from 1992 to until 2021. In 2022, we started a new partnership, 5-year partnership with the Centre for Health Economics at the University of York. What I would like to do is acknowledge all the work that my previous colleagues did when producing the unit cost manuals. Oh, sorry, I can't. Somebody's saying that they can't hear.
No, I think it's probably just a local problem.
Okay, brilliant. People can hear. Fantastic. I did actually think, have I actually unclicked mute? So it's fantastic that people can actually hear me present. So slide 7, Alan. So what do we actually mean by a unit costs? So a cost is always related to the amount, the unit of something being brought. For care services, this could be attending a daycare session or a week staying in a residential or nursing home. For the workforce, the unit cost would be a cost per working hour. So slide 8, please. So there's an underlying principle with our unit costs is to provide robust estimates based on economic theory. The most relevant economic cost is the long run marginal opportunity cost. So marginal costs, which means the cost of supporting one extra client or providing one additional unit of outputs. And then the long run aspect, it's that our estimates assume the change in activities are maintained into the future rather than representing a short-term investment. So the economic concept of opportunity cost considers that using resources in one way prevents their use in another way. Slide 9, please. So in terms of the components that we use to estimate our unit costs, so we have salary costs and on costs, capital costs, equipment, overheads, non-staff costs such as water, electricity, and qualifications. So in our estimates, in terms of qualifications, it's actually the initial training costs that we use. We don't have we are aware that professionals do other training after their initial qualification, and that's one area that we're looking into, so we know that there's a missing component. Other than for doctors, we do have that postgraduate cost for doctors. Slide 10, please, Ellen. So this slide just details all the secondary data sources we use annually to estimate our unit costs. So we appreciate all the data that we are sent on an annual basis, and we use data sets that are also online. Slide 11, please. So our unit estimations can be divided into workforce and care services. So I'm going to be talking through how we estimate a unit cost for both. So for a workforce, such as a social worker, we first want to identify the unit of interest, the cost per hour, cost per client, or patient-related work. We then want to calculate the effective working days by deducting sickness leave, annual holidays, and training days. So we get this information online every year, and then what we do with that information, we multiply working days by the number of working hours per day. Slide 12, please, Ellen. So I'm just going to run through an example of how we actually estimate a unit cost. So I've just picked example of a social worker. So you can see from this table a number of we use a number of data sets and information to produce a total cost for each health and social care professional. Typically, we calculate the total cost with and without qualifications, but we do recommend using the total cost that includes qualification, because that's the overall cost that when they were training to actually include that cost, it's giving you a complete total cost for that particular professional. So we also calculate direct, indirect overheads and capital overheads to then produce that total cost at the end. So slide 13, Ellen. So we then need to calculate the working hours. So this is calculated by multiplying hours per day by the number of days per year. But we also, so it's 607 working hours per year, but we do actually provide all of the other costs as well in our in the manual. Slide 14, Ellen. So in terms of the unit cost calculation for social work would be the total costs, which is 93,000. This is the cost that includes qualifications, which is then divided by the number of working hours, so 1,607 hours. So in total, the unit cost, including training for a social worker, is £58 per working hour in 2023-2024. Slide 15, Helen. So in our manuals, we have we cover a number of care services. Here is just one example how we calculate a unit cost for a week and a day staying in a local authority residential care home for an older person. So again, we use various data sets to calculate unit costs, which we combine into a total cost. And then we can calculate an establishment cost and then an establishment cost plus personal living expenses and external services. So slide 16. And so here are the unit costs for a local authority residential care home for older people. So we have per week, but also per day. So that is a brief overview of the history of our unit cost programme. The slides will be available. We are recording this webinar. So I'm going to hand over to Helen, who will now present on the current programme. Over to you, Helen.
Thank you very much, Karen. Next slide, please, Alan. So I'm going to talk about the current programme. So as Karen said, we've got funding from the NIHR PRP for 5 years, and we're 3 years in. You can see the list of people, the groups of people involved in the programme. So we've got our public involvement and engagement research advisors who are here today, and researchers from the Universities of Kent and York. Next slide, please. So we're really trying to think about why have we got this new phase of the unit cost programme? And we're very much building on the decades of work previously undertaken, as Karen said. But the aim, really, the chief aim remains that we're keen to ensure that the unit costs remain current, comprehensive and good quality. So why is this important? So we need costs to be as represented the most up-to-date financial year, and they need to reflect as many publicly funded health and social care services and workforce as we can. And we need to make them relevant to the different needs of different stakeholders. And there's lots of different stakeholders, be they members of the public, policymakers, commissioners and others. And in terms of quality, I mean, that's a big word, but we want to use the best data we can find to make the information as clear as possible, to make it reproducible, appropriate and accessible. In practice, we estimate and publish unit cost estimates each year, and we aim to continue to enhance the offer, making the best use of new data, for example, also to ensure that costs use the most suitable methods and consider areas for methods development. And threaded throughout, we've got our research advisors who've really, shaped what we do from the start and continuing on to the end of the 5 years. So next slide, please. So we've just really for our own purposes divided the research on the unit cost programme up into 5 work packages, and they're actually really best seen all together, but I just wanted to go through each in turn briefly. So the first one is work package 1, and we want to really keep on top of the new developments in terms of what new services and the publicly funded health and social care services are there, or there might be big changes in existing ones, and how can we use the unit cost manual with unit cost estimates to reflect those. Additionally, we know that there's increasingly more data being captured, and how can we best use that data? So to find out about this, we've both reached out to stakeholders, and we've already done one survey, and I think we plan another, just to really understand from their points of view what kind of new services are available and the data too, and kind of concerns of key interest to them. And secondly, we're doing a scoping review, and actually we've completed that, but we haven't written the paper yet. We've got a long report, and it was really to sort of really learn from the published literature how to estimate unit costs as best possible. So next slide, please. So talking about work package 2, we want to continue to enhance the offer, and we're consulting users. And one of the key things that we found were interesting to people is to develop a unit cost adjuster. And I'm going to talk about that very briefly now. And Alan, if you could just turn to the next slide, please. So I'm just going to give a brief taster of the unit cost adjuster, because in fact, in about a month's time, we're going to have a webinar specifically on it. But the rationale behind it is so that you as users can interact with it directly, because at the moment we produce a unit cost manual, which is a PDF online. But the logic behind producing a unit cost adjuster is that you would be able to override features within an Excel file. So for example, you might have salaries specific to your area that you would input into the unit cost adjuster, and it would the calculator would calculate a unit cost for you. And you can see here we've got unit costs. I think there's about 70 in total. It's not a static number, but we've got sort of workforce unit costs and also health and social care service unit costs. And through this Excel file, there's a sort of contents page where you can click on the service or staff that you're particularly interested in and go to that, and then see how the various components of the unit costs, and then interact with it to produce your own unit costs. Next slide, please. So this third work package is perhaps a little bit more research focused. It's to think about the nature and role of cost estimates, and actually some of the questions that you've been putting in the chat to reflect some of the questions that you have. We sort of go back to our economic roots on this, but as well as think about the theory, we need to bring that into practice, because this is very much a practical tool available to all for free online. So we're trying to sort of understand both of those aspects. And in the end, what we want to do is improve on the way that we calculate costs and how we report on them. Next slide, please. And I'll go on to work package 4. So I'll only briefly touch on this because Sarah will talk about this in more detail in a moment. But you can see our 3 research advisors here. All their advice is threaded throughout the 5 work packages that make up the programme, and with a specific focus on relevance, comprehensiveness, accessibility, and also trying where we can to maintain, adhere to the principles of equality, diversity and inclusion. Next slide, please. So I'm just going to go on to work package 5, which is really the culmination of everything, which is the unit cost manual, this PDF that's available each year online. And I just wanted to give some brief stats, and thanks to Alan for the sort of web analytics that we captured. So when we think about a year's worth of data capture for the unit cost manual for 2023, there were nearly 25,000 views of that. and there were over 13,000 full contents and records views, and people interfaced with the web page from 75 different countries, which is, you know, incredible, I find. And we had referrals to the Unit Cost website coming from the key one was from a Teams chat, but it was unnamed. But we also think that AI tools people are putting requests to AI tools online, and it's directing to us via tools like ChatGPT when they're interested in unit costs, but also national sort of websites like gov.uk and England NHS.uk. So that's really a very quick run through the work packages that form the programme. Many thanks, and just if you want to quickly pass through the next slide, and then we'll go on to Sarah's contribution to talk about PPIE. Thank you.
Okay, thank you, Helen. So I will talk today about how we're involving members of the public in the research and why we believe this is important for such a quantitative style research area. And just to acknowledge our research advisors, Douglas Finlay, Sarah Markham and Deb Smith, for their involvement both in this programme and their input into these slides. So on the next slide, and you will see, as we mentioned, that this is a new collaboration now between the University of Kent and University of York. And we've also introduced public involvement and engagement activities in this programme of work. So why we've done this is really to make sure that the programme considers the priorities in response to patient and public experiences, needs and preferences. We believe that involving members of the public in the research enables their lived experiences, their situations and certain connections with networks and communities that our researchers may not have. And in addition, by involving members of the public in this research area, we can ensure that the knowledge and the findings and the impact actually can reach the people in an accessible and non-academic way. However, for this programme, the research is very quantitative, and there is the question of, is this of interest to people who use health and care services and members of the public, and how do we make this accessible to a non-academic audience? And I've just included a quote here from one of our research advisors who say, you know, the unit costs can be very academic, and we can do more to make the outputs from the research not only useful but used. So if we move to the next slide, before I mention why the unit costs may be of interest to the members of the public, I just wanted to mention how we've involved our research advisors throughout the programme so far. So really our 3 research advisors have been involved from the start of the programme, and actually even during the pre-application stage right through to our current activities. So just to kind of give you a flavour of this, we involve our research advisors in our monthly project team meetings, in our yearly advisory group meetings, and really kind of any ad hoc discussions about specific activities. So for example, planning this webinar today. So in addition, our team are involved in reviewing any outputs, including the yearly unit cost manual, as well as any blogs or papers or abstracts. And also our team are involved in planning and design activities, which includes our website design. And if you look on the next slide, it also includes our infographic, which you may have seen on our social media posts about the webinar today. So moving on to the next slide, what we really just wanted to highlight is that all of these activities have a positive impact on improving accessibility and improving the content of our outputs. And if we just click the mouse again, Alan, what you will see is that we also maintain a PPIE impact log. And this is really to note all of our team's activities and potential impacts to the programme. So, for example, it increases the dissemination of our research. We move on to the next slide. Really, we can sort of consider this question that I've mentioned up front is, is the programme of interest to members of the public in general? So we've had some thoughts and we've got some examples of where the unit costs are used or where they're considered in the general public, and how we do believe this programme is important to the public. So firstly, there are people who, in general, they have an interest in health and social care costs. So this is demonstrated by various news articles, such as the one published on BBC News recently. We go on to the next slide. This was published in February 2025. So headlines such as "How much is the NHS going to cost us?" really kind of rouse this interest for taxpayers and voters and public in general. And also, kind of the costs of health and social care do generate this discussion and debate, especially when we see costs rising and comparisons with health and social care spending in other countries. And if we look on the next slide, there may be people who wish to delve a bit deeper into such costs, and they may find some key facts and figures such as these seen here. So, for example, how much money is needed to run our NHS for a certain time period. Go on to the next slide. How much it costs to fund our adult social care for a certain amount of time. And on the next slide, even just kind of breaking this down into how much an ambulance trip can cost, all of which are costs which are calculated through the unit cost manual. So if we look at the next slide, we can consider another reason for members of the public gaining an interest and understanding in health and social care costs, and it could be those who are interested in applying for private health insurance. On the next slide, you could see examples of various interactive tools on the internet which demonstrate different costs for various different health and care scenarios, all of which give an idea of the cost which could be incurred in the absence of our NHS or in the absence of private health insurance. So on the next slide, some people may be interested in the cost of health and social care when it comes to making decisions about social care provision for a relative or holding their local authority to account for social care spending and commissioning. So if we look on the next slide, again, there are online tools which could provide people with the costs for residential or home care, and we can specifically see this in our unit cost manual by looking up costs for home care workers per hour, or for local authority residential older person care. So on the next slide, kind of the final point here is really these are all just examples of highlighting what the sometimes invisible costs are for health and social care. And there is this notion that by providing members of the public with some of this knowledge, there could be an increase in public responsibility. So, for example, choosing the right course of treatment, which could be choosing to see a pharmacist instead of a GP for a certain condition, or highlighting the cost impact of missing GP or dental appointments. So on the next slide, what we have here is you may have seen something similar to these posters in our GP or dental surgery waiting rooms. And really, these are produced with the message of increasing public awareness and responsibilities for the hidden costs of care. And on the last slide, really just wanted to highlight how we've written a blog to this effect, which is titled Bringing Unit Costs to a Wider Audience, Making the Invisible Visible. And you can find this on our website. And we really hope that by culminating all of our public involvement and engagement activities, we can start to make some small steps in making the unit cost programme more visible and relevant to people who use health and social care. So thank you. On the next slide, as well as being able to find blog and various other information on our website, I would also just like to direct you to a feedback form, which will be live on our unit cost website from tomorrow. And then the final slide is really just to open up our question and answer session for this webinar. Thank you.